A 41-year-old mom caught a cold. Taking just one vitamin supplement caused her kidneys to stop working completely. This is her story. KL is a 41-year-old woman presenting to the emergency department at the University Medical Center with confusion, headache, abdominal pain, and respiratory problems. Her daughter tells the admitting nurse that she has vomited several times during the last few hours. She also denied any recent travel and told the nurse that her mom was not taking any medication. But when the doctors checked KL kidney function, they found out that her creatinine level was 10.1 milligrams per DL. What this means is that her kidneys were almost not working anymore, and there was only one way to save her life. She had to undergo emergency dialysis immediately. Today, we're going to see what happened to her kidneys when she took just one vitamin. There is always a lot to learn from cases like that of KL. Today's video is based on a real story, a case study actually, published in the Chest Journal in 2000. And the reason why today I'm showing you the story of KL is because there is a very important lesson to learn from her. You see, today's marketing is pushing the sale of supplements that are way more dangerous than people realize. Vitamins are no exception. If we take a look at what Amazon.com and other supplement stores have to offer vitamin-wise, we may see a large number of vitamin brands selling dosage too high to be safe for anyone. And it's one of the most used vitamins that cause KL kidneys to stop working. But the doctors didn't know which one. She was admitted in the state of confusion, and they had to perform several tests to find out which vitamin was causing her kidneys to fail. According to her daughter, KL started to develop a respiratory problem about 2 weeks ago. She told the doctors that she saw KL vomiting several times during the last 3 days. She also remembered seeing her mom taking pills, which was unusual for her, but she didn't know what the content of those pills was. We now know that KL was worried for her health and for her job. 2 weeks ago, she started to develop a sore throat, followed by persistent symptoms of respiratory problems. She was concerned that she might have caught the flu, so she took high doses of a certain vitamin. It didn't seem to work because she quickly started to get a fever.
Hello guys, present day Catherine here. In this video, I have put together a long format video of my stories from the emergency room series. Since it was one of my most popular series on YouTube, I decided to do some refinements to the episodes and put them together for a better viewing experience. Let me know what you think about it in the comment section. And by the way, I know this is a re-upload, but I had to do it because I had to spend 3 days working with my lawyers instead of creating content. Why, you may ask? Because as you have probably noticed, several bot channels are stealing all my videos. Yeah, pretending you are a doctor and stealing other people's work is all fun and games until someone sues you. So if you are one of my regular subscribers, please enjoy the show, and I'll be uploading a brand new video next Tuesday as usual. But if you're running a bot channel, be prepared to hear from my lawyers. Back to the video.
She was getting busy at work and couldn't afford to be sick, so she brought more vitamin bottles and massively upped her dosage. About 4 days after increasing the dosage, KL went out for dinner and started to feel stomach pain. After passing some watery movements, she thought that she had some kind of food poisoning, so she went home and drank some water and didn't eat or drink for the rest of the day because she simply wasn't hungry or thirsty. Interestingly enough, she didn't have to use the bathroom for the next 24 hours. So the big question the doctor needs to answer now is, what happened to KL kidneys when she started to take one vitamin? Doctors had to start a series of tests to find out which vitamin damaged her kidneys. What they found after a renal biopsy is that acute tubular necrosis and massive oxalate deposition were present in her kidneys. The vitamin KL was taking is a water-soluble vitamin. This means that when someone takes too much of it, the body will remove the excess through the urine. However, if the dose is really high, like in the case of KL, during the breakdown of this vitamin, one very dangerous substance is formed. Oxalate. Oxalate typically exists in your body via urine. However, under some circumstances, oxalate may bind to minerals and form crystals that can lead to the formation of kidney stones. Have you ever heard about calcium oxalate kidney stones? This is exactly what happened to KL kidneys. The levels of oxalate were so high that large oxalate crystal depositions were formed in her kidneys, completely shutting them down. But it was too late to do anything now. Her only hope was dialysis. The patient underwent 2 sessions of hemodialysis, but after learning what vitamin caused all of KL troubles, the doctors were worried. While this vitamin is generally regarded as safe, there are various documented cases of people ending up in the ER due to the misuse of this vitamin. What you see here is a different case study. This man took the same vitamin as KL and he lost his life. Okay, which vitamin caused KL's kidney failure? So have you guessed which vitamin in very high doses causes calcium oxalate deposition in the kidneys, kidney stones, and also diarrhea, nausea, and vomiting? I'll give you a hint. This is actually the most commonly supplemented vitamin in the world. It's also very useful and many kidney disease patients are recommended to take it even in a much smaller dose than what KL was taking before ending up in the emergency room. So which vitamin are we talking about? If you know the answer, please write it down in comment section. Yes, the vitamin that sent KL to the emergency room is vitamin C. After 2 dialysis sessions, KL started to regain consciousness. As the doctor were suspecting, she admitted to the daily use of vitamin C in large doses. She told them that to control her respiratory problem, she started to take vitamin C in large doses. At first, she was taking 500 milligrams tablets, 4 to 5 tablets daily. On further inquiry, the patient was able to recall that she had begun taking even larger numbers of vitamin C tablets a few days prior to the onset of symptoms, up to 10 tablets daily or 5,000 milligrams. Now guys, before getting back to KL's story, we will finally see if she was able to get home to her daughter safe. There is a very important question that needs an answer. Is taking vitamin C safe for someone with kidney problems? Okay, what we absolutely need to understand about vitamins is that basically any vitamin can cause serious problems when the dose is too high. Now, this is the whole point of today's video actually. I always show you the benefits of the remedies and vitamin that can be of help for someone with kidney problems. But I also always tell you the same thing. Please consult your doctor and get informed before taking this remedy. Because as we have learned, even a remedy as safe as vitamin C may be incredibly dangerous even taking in the wrong dose. So now you may ask, what is the safe dose for vitamin C supplements? The recommended daily amount for vitamin C is 75 milligrams a day for women and 90 milligrams a day for men. The upper limit for all adults is 2,000 milligrams a day. Now guys, these doses are for people without kidney problems or a history of kidney stones. If you have chronic kidney disease, especially in the advanced stages, the recommended dose for vitamin C from supplements is even lower, just 60 milligrams per day. And for those with a previous history of calcium oxalate kidney stones, even this dose must be approved from a doctor. So we may understand now why taking 5,000 milligrams, this is what KL was taking, of vitamin C per day is extremely dangerous. Okay, do you want to know how it ends? Did she make it? After 2 weeks in the hospital and 2 dialysis sessions, KL was able to urinate regularly again. On day 14, measurements showed a band of 40 milligrams per dl and a creatinine level of 2.2 milligrams per dl. These levels told the doctors that her kidneys were now working and the patient was discharged home with follow-up in his hometown.
In December 2022, a 55-year-old woman, kidney disease patient, presented to the emergency department lethargic, severely bradycardic, suffering from visible swelling, and with a body temperature of just 93 degrees. The doctors tested her creatinine levels immediately because they thought about the worsening of her kidney disease. What they found out was shocking. Her serum creatinine level was now 35.30 milligrams per dl, several times higher than what it was just 2 months prior. Her kidneys were failing. She was not making urine anymore. Her body was so overrun by uremic toxins she had to be immediately transferred to the intensive care unit. The 55-year-old woman was started on dialysis the same day of admission. But now the doctors were stumped. What could have caused this woman to lose all of her kidney function so fast? After thorough investigations, they were finally able to determine a cause. The cause of her extremely fast loss of kidney function was later found to be a completely normal vitamin thousands of people take every day. Catherine here. I've been working with kidney disease patients for more than 10 years now, and if you are one of them, there is a hidden danger that may be lurking in your bathroom cabinet. No, it's not a prescription drug. It's a vitamin supplement. There are actually 5 vitamins that may be extremely dangerous for you if supplemented incorrectly. So, what I will show you today is a serious danger for people with kidney disease. Because while not taking vitamin supplements may be very bad for your kidneys, you should also be careful with what you take. You see, the case I've just shown you is just one of a long list of hospitalizations due to incorrect vitamin supplementation, and we will see how it ended up for her later on in this video. But that's not an isolated case. Just a few months ago, a TikTok influencer ended up with kidney stones because of a vitamin she was taking for her immunity. Earlier this year, a 61-year-old male ended up hospitalized with excruciating pain due to what doctors believed to be pancreatitis. They were shocked to find out that the reason of all that pain was a vitamin supplement. A different patient was also hospitalized with recurrent vomiting, nausea, leg cramps, and a weight loss of 28 pounds, all caused by taking vitamin in excess for just 1 month. His kidneys were destroyed. And I'm showing you these cases because it's imperative that you get informed about the supplements you take, the doses, and the risks. Because when it comes to supplements in general, and vitamins in particular, people with kidney disease are way more at risk than the general population. Those with impaired kidney function cannot properly dispose of excess vitamins from supplements, and this may put your kidneys at risk. Okay guys, if you follow me here regularly, you probably already know that you need to be careful with many supplements, and vitamins in particular should be always treated with cautions. Today we talk about 5 hidden dangers not many people are aware of. Some of these vitamins are only dangerous if taken in the wrong form or dose, while others are always dangerous if supplemented by someone with kidney disease. So be very careful with these 5 vitamins. Let's start with the less dangerous, our number 5, and then we will see vitamins that are increasingly worse and worse. Number 5 is actually a vitamin that may be very good for you if taken the right way. Number 5, vitamin D.
What?
Yeah, now you may ask, But Catherine, you told us 1,000 times that we need vitamin D in order for our kidneys to be healthy. What changed now? Well, while it is true that you should take vitamin D, you should also be careful with this vitamin. Vitamin D is a fat-soluble vitamin, which means that it can accumulate if you take too much of it. Not just that, vitamin D is also used by the body to absorb calcium and phosphorus. This means that having too much vitamin D can lead to hyperphosphatemia and hypercalcemia. Both these conditions can be very serious, especially because they both lead to arterial calcification. Actually, taking too much vitamin D may even directly cause acute kidney injury or fast kidney damage. And yeah, this is why I am pissed at those people that are telling you to take huge doses of vitamin D. Now guys, when it comes to vitamin D, having 2 levels of this vitamin is way more common than having too high levels. And unfortunately, this can also damage the kidneys. How can we avoid that? Well, take vitamin D in the right dose, which is usually around 2000 IU of vitamin D per day. And also always take it with 100 milligrams vitamin K2 to avoid arterial calcification and with magnesium. Yeah, this is how you take vitamin D safely. And guys, if you think this info is important, consider sharing this video with anyone you know who suffers from CKD. And also give it a like so more people will have the chance to see it. And yes, knowing that there are vitamins out there that can be dangerous and you still have to take them may be scary. I get it. But it's always better to be informed and to protect your kidneys than to risk renal failure without knowing why. Actually, there is another vitamin that you have to take, but with caution. In fact, the synthetic form of this vitamin may actually turn into poison. Number 4 is cyanocobalamin. Cyanocobalamin is the synthetic form of vitamin B12, alright? You don't get this vitamin from foods, just from supplements. And well, this is what makes it dangerous. You see, when most brands produce a multivitamin, they don't use methylcobalamin, the natural form of vitamin B12. They use cyanocobalamin. This synthetic form is not found in nature, but it's cheaper to manufacture than the natural form. This is why most multivitamin contains cyanocobalamin. Unfortunately, if you take this synthetic vitamin with CKD, you may actually be at risk of cyanide toxicity. Yes, cyanocobalamin, as the name suggests, contains small amounts of cyanide. But most people can still take it. Their kidneys will get rid of this cyanide without problems. And now you may ask, what happens if I have reduced GFR? Will this cyanide put me in danger? Well, yes, unfortunately. And this study points out, metabolism of high doses of cyanocobalamin may generate small amounts of cyanide, for which clearance may be reduced, and this may cause a faster decline in GFR. Which means that in someone with CKD, taking cyanocobalamin may be linked to faster damage to the kidneys. In short, be very careful with your vitamin B12. While most CKD patients must take this vitamin to avoid anemia, it should be methylcobalamin, not cyanocobalamin. Double check your supplement bottle and make sure you are taking the right form and dose. 6 micrograms a day of methylcobalamin are usually recommended for CKD patients following a plant-based diet. Consider that this vitamin is not well absorbed by the body, so supplement manufacturers usually pack huge amounts of synthetic B12 to overcome this issue, even 100 times the RDI. Be careful and double check your labels. However, also remember that vitamin B12 is essential for your health and that you can only get it from supplements if you are following a renal diet. Don't risk a B12 deficiency because it can lead to several dangerous symptoms including elevated homocysteine, vascular disease, and anemia. Up next, our number 3. This is even more dangerous. This everyday use vitamin might be literally making you sick. Studies have linked it to a significantly increased blood pressure. It may even increase the risk for stroke and cancer. Other research says it can lead to bone loss, raise cholesterol levels, and even kidney damage, even in the general population. But this vitamin is still being manufactured despite all these dangers, so be careful and never take alpha-tocopherol, the synthetic form of vitamin E. Okay guys, if you follow me here regularly, you probably already know that vitamin E is not something you should be supplementing if you have kidney disease. Now the problem with alpha-tocopherol is that food brands are putting it everywhere. Supplements, nutrient-dense, powders, drinks, and foods. Make sure nothing you take regularly has this vitamin, because as usual, the danger is much bigger for people with kidney disease. Now, vitamin E in its natural form may actually be beneficial because it's supposed to be a powerful antioxidant, and high-potency antioxidants are one of the most promising advancements in the treatment of kidney disease. I still do not recommend supplementing vitamin E unless explicitly prescribed by your doctor, obviously, especially not the synthetic form. And while vitamin E may actually have benefits for you, my advice is to only get it from foods. Sunflower seeds, for example, are a real powerhouse when it comes to vitamin E. Just 1 ounce of these seeds contains up to the 66% of your DV for vitamin E, and that's a lot. In short, don't supplement vitamin E. Alpha-tocopherol, the synthetic version of vitamin E, seems to be especially dangerous. Never take it. Be careful with any supplement containing this vitamin, especially at high doses. Okay, our number 2 now. There is only one vitamin that's even more dangerous than alpha-tocopherol. Number 2 is a vitamin that can damage your kidneys even if you only get it from foods. And yes, there is only one vitamin that can do that. Number 2 is vitamin A. Now, vitamin A is the main reason why multivitamins are banned for people with CKD, alright? If your kidneys are impaired, you cannot take a regular multivitamin. I'm talking about your run-of-the-mill Centrum or your Smarty Pants or your Supradyn if you are in Europe. None of this is safe if you have a reduced GFR. And the reason is vitamin A. It may cause kidney damage even in the amount you find in multivitamins and even in the amount you find in certain foods. This vitamin can accumulate in the body and may be toxic, leading to potential adverse effects such as birth defects, liver toxicity, and other health issues, including fast kidney damage. Yes, people have been hospitalized with acute kidney injury just because they ate too much fish liver. It's not very common, fortunately, and you can only have this issue by eating too much fish liver. Still, be careful because the dose for vitamin A present in normal supplements is not safe for people with kidney disease. Okay guys, time for our number 1, and I bet you want to know which vitamin destroyed the kidneys of the 55-year-old woman I was telling you about in the intro. There is probably only one vitamin that can do that amount of damage to the kidneys in just 2 months. This vitamin is probably not as dangerous as alpha-tocopherol or even vitamin A, but it's linked to way more hospitalizations than those two combined together. The reason? Well, our number 1 is the most commonly supplemented vitamin in the world. So question, what vitamin was the woman taking? Well, according to her doctors, she was taking a long list of supplements: calcium, digestive enzymes, cranberry, a daily multivitamin, vitamin D, and also vitamin C. But only one of these caused her hospitalization. And the way they were able to find out which one was by looking at her kidneys. In fact, a kidney biopsy revealed a huge amount of oxalate crystals, the kidneys of the 55-year-old woman. Only one vitamin can cause this: vitamin C. In fact, the woman was taking 1,000 milligrams of ascorbic acid every day, and this was enough to permanently destroy her kidneys. Unfortunately, unlike what it usually happened with kidney stones and oxalate crystals, she wasn't able to regain her kidney function anymore. Now the worst part, this dose you see here 1000 milligrams a day is not that big for a dose, even. But this is all it needed for this vitamin to completely destroy the kidneys of a CKD patient. And this is why this vitamin is our #1 for today. Most brands sell vitamin C in the exact same dose the 55-year-old CKD patient was taking, 1000 milligrams a day. They will also tell you on the bottle to take one 1000 milligrams tablet a day, as we can see. Now, this is just one of the thousands of brands doing this. This is why this is our #1 for today. Most people think this vitamin is safe, but it's not. Yes, this is a sad story and a cautionary tale. Always make sure you are not taking vitamins in too high doses. Just because a little bit of something is good doesn't mean a lot of something is better. If you take vitamin C supplements, you may want to take a closer look at your dosage. 100 milligrams a day is usually fine, but 1000 milligrams a day can destroy your kidneys. Make sure you are not taking too much of this vitamin. But as I was saying, supplementing vitamins in the right dose is a must for the vast majority of CKD patients. In 2019, a 71-year-old man, father of 2, was brought to the emergency department with severe shortness of breath and weakness. He and his family were shocked to learn that he had to start dialysis immediately. They were shocked because he never had kidney disease and his kidney function was more than 60 at his last checkup. But now he's struggling to breathe and the doctors say that his kidneys are the cause. But why is that happening? Well, after studying his case in depth, the doctors found out that a food the man started to eat just a few months prior has caused his kidneys to fail. A plant-based food that is supposedly healthy. And while there is no denying that a plant-based diet is the cornerstone of any treatment for kidney disease, not all plant-based foods are healthy for you. There are 8 fruit and vegetables that you should keep an eye on next time you go grocery shopping. Some of these will make your sugar levels skyrocket. Some will make you gain weight, and some, like the food that the 71-year-old from today's case study consumed, may even destroy your kidneys.
We avoid it.
So be careful and make sure you are not eating any of these 8 foods without knowing about the risks. Now, a little heads up before we start. This is not a comprehensive list of foods to avoid, just fruit and veggies with hidden risks. Because I believe that if you follow me here regularly, you already know that animal-based foods such as meat, fish, and dairy, and also many processed foods are bad for you. So I'm not gonna talk about that. Only about foods that can be bad for you even if they are plant-based. And also I will tell you immediately that some of the foods in today's video are only dangerous if eaten in too high amounts, alright? So if it's on this list, it doesn't mean you can't have it at all. But that you should be careful. Let's see why now. Starting with number 8 is blackstrap molasses, tomato sauce, and dried fruit. Now these foods are not going to send you in dialysis. They are still dangerous though. They may cause your heart to stop beating. And the reason why CKD patients are supposed to avoid these foods is because they are too rich in potassium. Okay, now you may ask, but Catherine, you always say that potassium is not dangerous for us. That's right, almost all high potassium fruit and veggies are not forbidden anymore for people with CKD. But there are still exceptions to the rule. You see, some food items are way too high in potassium to be really recommended. These foods can be considered a hidden danger. I'm talking about dried fruits, for example. I wouldn't recommend eating dried apricots, raisins, and prunes to someone in stage 4 CKD even with normal potassium levels. The reason? When these fruits are dried out, many nutrients are lost, but not potassium. In fact, dried apricots, for example, have about 850 milligrams of potassium per 100 gram serving. That's a huge amount. That's like eating 5 bananas in one sitting. Unless your potassium levels are too low, this can be dangerous if done regularly. So don't avoid bananas unless your potassium levels are too high already, but be careful with blackstrap molasses, tomato sauce, and dried fruits. And guys, if you think this info is important, share this video with a friend and also give it a like so that more people will be able to see it. Okay, up next, a vegetable with a hidden danger even worse than potassium. Number 7 is legumes. Okay, this is something that's really more on the limit list rather than the avoid list. Legumes can actually be very healthy for you. In fact, recently we learned about a stage 5 patient already on dialysis that was able to reverse his kidney disease back to stage 4 thanks to a diet rich in legumes. But you see, this doesn't mean you can eat legumes with abandon. The reason is their protein content. Protein is very dangerous for you if you have kidney disease. Excess protein intake is one of the main reasons why most patients cannot stop the decline of their kidney function, says science. In fact, while high potassium foods are forbidden just to those patients with too high serum potassium levels that can't be resolved with better medications, high protein foods are forbidden to everyone with CKD, including those in stage 3. So my advice here is not to completely avoid legumes, but to be careful with them. Most beans and soy in particular are very high in protein and they can easily make you go over your daily limit for this nutrient. String beans, chickpeas, and lentils are lower in protein and they are safer. Up next, a food that can be even more dangerous if eaten in too high amounts. Number 6, nuts. Just like legumes, nuts are high in protein and they should always be eaten in moderation. But there is a reason why nuts are higher on this list of dangerous fruits and veggies than legumes. Nuts are also very high in calories and this can be a problem especially for people with diabetes or those that need to lose weight. But how caloric dense are nuts actually? Well, to give you an idea, this you see here is 200 calories from mixed nuts compared to 200 calories from apples. Same calories, very different amount of food. Now guys, this doesn't mean you should completely avoid nuts, not even if you need to lose weight. It just means that you should eat nuts in moderation. Because just like legumes, nuts can be extremely healthy. For example, walnuts are full of omega-3s, which are essential fatty acids that are pretty hard to get in a renal diet. Almonds are full of magnesium to lower your blood pressure. Pecans are full of antioxidants. Brazil nuts have selenium, a mineral that protects the kidneys. But they are also caloric dense, so moderation is key here. And yes, this can really make a difference if your goal is avoiding kidney failure. Just like avoiding the next entry for today. Before I show you what it is, a question. Is any of these foods the cause for the 71-year-old man to end up in dialysis? Well, no, it's actually the number 1 for today's video, so don't miss it. Because if you want to understand which ones of these foods are just bad and which ones can literally destroy your kidneys, you need to see the number 1. Well, yeah, this is a top 8 list, so the higher the food on the list, the more dangerous it is. But we must also account for how your body will react to these foods. Not everyone reacts the same way to what they eat. In fact, an abnormal reaction to a certain food item was what caused the 71-year-old father of two to lose all of his kidney function in a few months. Actually, when the doctors started to investigate, what they found in his kidneys was so remarkable they actually wrote and published a case study about this finding. A crystal buildup similar to extended kidney stones was found in his kidneys. And that was very strange because the man never suffered from kidney stones nor had the risk factors. The most interesting part was discovering that the food that caused all his trouble was a food that's usually considered very safe, and it's also the number 1 of this list, so don't miss it. Before that, our number 5, which is canned veggies. Okay, let's talk for a moment one of the most dangerous minerals, sodium. Excess sodium or salt in the diet is one of the worst causes of hypertension, heart and kidney disease because while salt by itself is not dangerous, you only need a very small amount of it. This is what you need, 1.5 grams of sodium a day, no more. And I know that you guys following me right now do your best to avoid excess sodium in the diet. The problem is not you. The problem is marketing. Fact. According to a recent statistic, over half of the packaged foods that are sold as healthy are too high in fat, sodium and sugar. Yes, it's very easy to get fooled by the marketing department. It's basically their job. But make sure this doesn't happen to you. Your kidneys are on the line. Canned vegetables are especially dangerous. They tend to be higher in sodium since salt is often used as a preservative. For example, a half-cup serving of canned peas has around 310 milligrams of sodium. Now also keep in mind that this danger can be limited if you rinse canned foods very well or if you can find brands that sell low-sodium canned vegetables. So be careful, always read the labels and rinse your canned veggies. Our number 4 is especially bad because it may put you at risk for toxin exposure right when you are eating some very healthy foods. This one is so dangerous that it may even increase the chance of developing CKD by 25%. I'm talking about number 4, the dirty dozen. Okay, I cannot make a list of veggies that are potentially harmful to the kidneys without mentioning the dirty dozen. These foods are way more dangerous than people realize, a real hidden threat for CKD patients. So what is the dirty dozen? And why are these foods so much more dangerous than most people think? The Environmental Working Group EWG, a non-profit organization that exposes the health risks of industrial agriculture, has compiled this list based on extensive testing and analysis. The dirty dozen are the foods that they found to have the highest levels of toxic chemicals. Pesticides, fungicides, the harmful chemicals and other toxins that shouldn't be on fruit and veggies, that shouldn't be used at all, and that are still in our food in 2023. Yes, they keep finding banned pesticides on fruit and veggies, such as DDT, for example, that was banned decades ago, but that still lingers in the soil. So what foods are in the dirty dozen? In 2023, the foods in the dirty dozen are strawberries, spinach, kale, collard and mustard greens, peaches, pears, nectarines, apples, grapes, bell and hot peppers, cherries, blueberries, green beans. And most importantly, should you avoid these healthy fruit and vegetables? Well, no, I don't think you should avoid them. So don't throw away your kale and apples now. They are better solutions than avoiding this long list of foods. What to do then? First of all, make sure you wash your produce very well. Use a water and baking soda bath. Scrub the peel of your fruit if you want to eat it and rinse everything with lots of water. Then dry everything with a clean cloth. And also consider buying organic, especially when it comes to the foods in this list. Okay, time for our top 3 now. We have seen some foods most people can still eat on this list, either in moderation or by taking precautions. Time now to see some vegetables that can cause very serious damage to your kidneys. There are 2 entries in this top 3 that you should always avoid, and one that could potentially send you in dialysis. This is what happened to the 71-year-old man that I featured in the intro of this video. Okay, we will see what food caused this in a moment. Before that, our number 3. This is a vegetable-based product you should always avoid, no matter what. Number 3 is vegetable oils for frying. Okay, vegetable oils come with 2 dangers. First of all, just like nuts, oil is very caloric dense. Oils in general are actually the most caloric dense food item that there is. It's hard to explain this in words, so here's an example. This you see here is 200 calories from apples compared to 200 calories from canola oil. Yeah, the amount of oil in that glass is so small you can barely see it. And it has the same identical amount of calories you will get from eating 2 medium-sized apples. So yeah, oils are extremely caloric dense. Make sure you keep this fact in mind. This is especially important for people with diabetes and for those that need to lose weight. But it also could be a good thing for those patients that are in an advanced stage of kidney disease, alright? If you are struggling to keep your body weight on, olive oil in particular can be your best friend. It's so easy to add a ton of calories if you add olive oil to your meals. You won't even notice the oil. Now, the reason why oil is so high on this list is because most people use oils for frying, and this is bad. Frying oil is way worse for your kidneys than the other foods we have seen until now. Fried foods are high in saturated and even worse, trans fats. These fats have been linked to increased blood cholesterol levels, more arterial plaque, heart and kidney damage. Don't fry your foods. Okay, something even worse that still has the name fruit on it. Number 2, fruit juice. Fruit juice is one of the worst food items ever to be associated with fruit, especially because it's marketed towards the youngest. It's no secret that food companies are to blame for today's growing obesity problem, and fruit juices are one of the causes. If you're drinking a cup or 250 milliliters of fruit juice, you're ingesting up to 30 grams or 8 teaspoons of sugar, and that's a lot of calories that will go in your blood real quick, causing a spike in insulin. And added sugar is not just linked to diabetes but also to high blood pressure, inflammation, heart disease, and a ton more health issues. So yeah, always steer clear of fruit juice, but what can be even worse, you may ask? Our number 1 for today. This is the food that sent the 71-year-old man, father of 2, to the emergency room. Back to our case study. As the doctors found out after doing a biopsy, the cause for kidney failure was a buildup of oxalate crystal. And do you want to know what foods caused it? Well, the reason why the 71-year-old man had kidney failure is the diet too rich in peanut butter and coffee. Now guys, wait a minute before you throw away your coffee machine and your peanut butter jar. You see, what happened to this man is actually very strange. It's uncommon enough that they made a case study about it. You see, oxalate crystal, just like kidney stones, are usually present in people with oxalate sensitivity, which the patient didn't have, or in those following a diet too poor in calcium, and in those that don't drink enough water. And he didn't do any of that either. He was just eating tons of peanut butter and also 3 to 4 large cups of coffee daily, and this brought to the discovery of a pathology that was never seen before, a rare genetic condition that this man has. Well, so the lesson here is not to exaggerate with peanut butter and coffee, especially if you know you have an oxalate sensitivity. A 45-year-old woman went to see a chiropractor for her back pain. She was recommended to try megavitamin therapy. This is what happened to her kidneys and bones. In 1985, DL, a 45-year-old woman, presented to the Columbia Presbyterian Medical Center with anorexia, an orange hue on her skin, and a broken leg. But she was told to wait as she was given low priority by the hospital staff. However, after some time in the waiting room, she starts to lose consciousness before slipping into a coma. This is when the hospital staff realized that the broken leg was just one of the symptoms of a more serious issue. You see, earlier that year, DL went to see a chiropractor for her back pain, and while back massages and bones cracking didn't really help her, the chiropractor had an idea. DL, you should try a megavitamin therapy, he says. DL never heard about the megavitamin, but since nothing else worked for her back, she decided to give this new therapy a try. It's just vitamins, and vitamins are good for you, she thought. What could possibly go wrong? And at least for a while, the megavitamin therapy worked. She had a huge improvement in the intensity of her back pain. But that wasn't going to last, unfortunately. Just a few weeks after starting the therapy, DL began to lose weight at an alarming rate. Her belly, however, started to look swollen. And then her back pain came back with another symptom. That morning, she woke up too early again because she needed to go to the bathroom for the 5th time after going to bed. But what worried her even more was her skin. It was almost completely orange now. How could I have not noticed this? She thought. This is when she starts to get really upset. And while her husband, woken up by all that commotion, tries to calm her, DL trips and falls, breaking her leg. What I have for you today is a cautionary tale. This story is based on events that actually happened and that were documented on medical journals. And it's all about the single most dangerous vitamin you should never supplement. Seriously, don't supplement anything without talking to your doctor. So the question is, do you know which vitamin is the most dangerous to supplement? Now, the assumption here is that you should never supplement any vitamin without a specific need, especially if you have kidney disease, diabetes, or another diagnosed condition, especially not in high doses. Because while vitamins may be extremely helpful if supplemented correctly, all supplements have some inherent danger. And there are some vitamins that are more dangerous than others. You see, there are two kinds of vitamins. Those that are soluble in water include vitamins of the B group and vitamin C, and those that are soluble in fat, including vitamin A, D, E, and K. While water-soluble vitamins are immediately excreted by the kidneys, when taken in too high doses, fat-soluble vitamins can accumulate in your body's tissues. This makes them dangerous when taken for too long periods of time or in too high doses. And one of these vitamins was taken by DL in very high doses as recommended by a very incompetent practitioner. In just few weeks, it caused her to start urinating uncontrollably, dozens of times a day. It also caused her to develop anorexia. It caused her belly to become swollen, her skin to become orange, and her bones to break. What happened to DL kidneys and bones when she started a megavitamin therapy? At physical examination, the medical staff at the Columbia Presbyterian Medical Center found out that DL's skin was not just orange but also very dry. Her nails were fractured and a fluid buildup in her abdomen was also found, which was causing her stomach to be swollen. This could mean that DL liver was damaged, but blood tests indicated that liver function was instead normal. DL creatinine was, on the other hand, too high at 4.1 mg per DL, indicating that her kidneys were taking damage. But this creatinine level didn't explain her symptoms. After further examinations, the doctors were finally able to find a clue. DL was suffering from hypercalcemia, or very high levels of calcium in blood. They didn't find, however, any vitamin level to be too high. Instead, it was revealed that DL was dehydrated, which is consistent with her profuse urination before falling into coma. There are now a few clues for what is causing DL to go into coma. Anorexia. Fluid in her abdomen, brittleness of her bones and nails, skin that became orange, very high calcium level in her blood. The doctors also knew from DL's husband that she was undergoing a megavitamin therapy. He didn't know, unfortunately, which or how many vitamins she was taking. Which vitamin sent DL to the emergency room? Now guys, if you can tell which vitamin is causing all of DL symptoms before our doctors came up with a diagnosis, write the answer down in comment section. The vitamin DL was taking is the most dangerous vitamin there is, especially for someone with kidney problems. We will follow her medical team as they try and diagnose what is causing all of her problems. But if you can guess at any time which vitamin is the culprit, write it down. It's clear that DL is suffering from hypervitaminosis, and that's responsible for her liver and kidney damage, her hypercalcemia, and her broken bone. The doctors knew that no water-soluble vitamin could have caused all of her troubles, mainly because water-soluble vitamin cannot stay in the body for too long since they get excreted in the urines, and all the vitamin levels in DL blood were regular. This leaves us with 4 vitamins: vitamin A, vitamin D, E, and K. Vitamin E toxicity hypothesis was also discarded because vitamin E has a strong blood thinning effect, and DL wasn't suffering from any bleeding. Vitamin K was also discarded because vitamin K is used by the body to bind calcium. DL calcium levels would have been too low, not too high. Now, both vitamin A and D are linked to calcium metabolism. Both vitamin A and vitamin D can cause calcium levels in blood to be too high. But only one of these vitamins will cause the skin to turn orange and liver and kidney toxicity. Have you guessed which one? Now guys, we will see if DL was eventually able to make it in a moment. As I was saying, this video is a cautionary tale. It's not uncommon to read in medical literature about people erroneously recommended to do therapies that cause more harm than good. And in many cases, medical practitioners that are not supposed to prescribe any drug at all, such as a chiropractor, are the cause. We have also seen that happening in my video about aristolactic acid. That was a very unusual case study. A woman progressed from normal renal function to advanced renal failure and end-stage renal disease in just 8 months. She needed a transplant after that. Her kidneys never recovered. According to the documentation, 5 months before the start of the symptoms, the woman took herbal medicine for pain relief, and that herbal medicine was prescribed to her by her acupuncturist. This video is up here if you miss it. And while vitamins are usually safer than herbal remedies, many people take them in doses that are way above the recommended daily allowance. This is what megavitamin therapy is all about. Megavitamin therapy is the use of large doses of vitamins, often many times greater than the recommended dietary allowance, in the attempt to prevent or treat diseases. And it was eventually found out that what caused all of the DL problem was exactly that. It was eventually performed a transjugular liver biopsy on DL. In this procedure, a catheter is placed through the jugular vein in the neck, guided through the heart and down into the liver, where a sample is collected. What was found confirmed the doctor's hypothesis. DL had an increased number of fat-laden stellate cells, meaning that vitamin A had been accumulating for some time in her liver, engorging the cells, causing them to die and form scar tissue inside the liver. This means that DL was experiencing vitamin A-induced hepatotoxicity, and that the megavitamin therapy was slowly destroying her liver and kidneys. And as I was saying, vitamin A is extremely dangerous for someone with kidney disease. It is crucial for someone with CKD to never supplement vitamin A. As I was saying, if the kidneys cannot remove this vitamin properly, toxicity and damage to organs are even more likely. And even if DL didn't have kidney problems before her megavitamin therapy, she took enough vitamin A to damage her kidneys too. But the doctors were more worried about her hypercalcemia. It required therapy with mithramycin. This is an antibiotic that also used to treat cancer and to bind to excess calcium in blood. Okay, do you want to know how it ends? Did she make it? Let's see. After the second treatment with mithramycin, her calcium levels stabilized in the normal range and DL was eventually able to exit the coma. The problem with vitamin A is that there is no way to remove it from the liver, however. Doctors were able to treat her fractured bone. They were also able to drain the fluid in her abdomen. But there is nothing to do about excess vitamin A. This is why her calcium levels kept rising during the next months. She was eventually discharged and recommended to immediately stop the megavitamin therapy, which she did. She was also being monitored as an outpatient for her liver and kidney function. At discharge, nail and skin problems were beginning to resolve and the swelling in her abdomen was diminished, indicating some recovery of liver damage. But her calcium levels kept being too high for several months. Her liver disease progressed with the development of further swelling in her abdomen. But clinical evidence for improvement in other areas was appreciated by a gradual return of muscle strength and improved mental status. She was able to gain some of her weight back and eventually she made a recovery. Hey Dad, you know what will be a great New Year resolution? You could try to get in better shape. You know, you could start eating more vegetables for your kidneys. A 61-year-old dad decided to improve their health. He started following a better diet full of veggies he was never eating before, such as spinach, potatoes, beets, rhubarb, and more. This is what happened to his kidneys. CM is a 61-year-old businessman and father of 3, presenting to the emergency department of the Health Adventist Medical Center in Bolingbrook, Chicago, with severe shortness of breath and weakness. He is on a wheelchair because he can't support his own weight anymore and he is gasping for air. They will later find out that his creatinine was very high at 15.11 milligrams per dl, meaning that he was suffering from acute kidney injury and he was in need of emergency dialysis. His son explains to the admitting nurse that just a few weeks earlier, he convinced his father to start eating vegetables. Is this all my fault? The son asked the nurse, but the nurse shrugged off that hypothesis. Vegetables don't cause kidney damage. Or do they?
Wait. What?
Gathering here, welcome today to a new real story from the emergency room. As usual, this patient story is based on a real case report which was published in the World Journal of Nephrology and Neurology in March 2020. But today's case is special to me and, well, today's case also comes with a warning. Things are not always what they look like in a medical mystery like this one. What caused a CM problem is still being studied today by medical science. This is a type of kidney damage that doesn't happen very often, just in about 12 patients in the last decades. And if you think this is interesting, remember to share this video so other people can enjoy it too. But don't get to a conclusion about what happened to CM before seeing how it actually ends. Because you see, before being hospitalized, CM was suffering from diabetes and gout, but his kidneys were okay. He was taking metformin for his diabetes, statins for his cholesterol, and allopurinol for gout. But CM never really paid any attention to his own health. His job and his family always took priority in his life. Nothing else really mattered, his own health included. He would very frequently binge on peanut butter by eating up to half a jar in a single sitting. And he was also used to drink 3-4 large cups of coffee daily. But this year, it was going to be different. CM promised to his younger son. And he took his New Year resolution pretty seriously. A promise to his own son wasn't something he was going to forget, and he decided to start immediately getting better by adding more vegetables to his diet. But that's when things started to go south for him. After 1 month of his new improved diet, his legs started to swell. He never suffered from swelling before, but he didn't really have the time to pay attention to that symptom. He had too much work to do that week. After 2 months of his vegetable-rich diet, he woke up one morning so tired he was barely able to get up from his bed. He had to call in sick at work for the first time in years. Even his secretary was dumbfounded and worried. CM was never sick and he was always working. He eventually did get up from his bed just to go to the bathroom. What happened next really scared him. There was something red in his urine. And he also noticed for the first time that he was breathing way faster than what he was used to. What is happening to me? He thought. Should I be booking an appointment with my doctor? Or are you supposed to call an ambulance if you see red in your urine? But there was no more time now. Going back to bed, CM's head started to spin so fast he lost his balance and fell to the ground. He was barely able to reach his phone and to call for an ambulance. When CM was brought to the emergency department, he was found to have suffered severe acute kidney injury. His kidneys were not working anymore, and that was causing all the symptoms: swelling, fatigue, hematuria, even his inability to breathe and to sustain his own weight. Something was destroying his kidneys, and it was not diabetes because, well, it was way too fast to be diabetes. You see, before being hospitalized, CM creatinine was just 1.6 milligrams per dl, just slightly high, not even high enough to be considered kidney disease. His diabetes was being treated, and he had no family history of renal disease, kidney stones, or any gastrointestinal disorders. His creatinine was now 15.11, however, and his GFR was down to 2.8. His kidneys weren't working anymore. But why? What was causing all that damage to his kidneys? After the first dialysis session, CM was lucid enough to help the doctors finding a diagnosis. He confirmed that he was still taking his diabetes medications, and he also denied any consumption of dangerous substances. He wasn't even taking NSAIDs or antibiotics known to cause damage. He told the doctors he was never exposed to anything dangerous for his kidneys, like contrast media in an MRI. Nothing made sense, and the doctors were confused. But you know, CM kidneys weren't being destroyed by an alien force or an ancient curse. There must have been a medical explanation for what was happening. Maybe a renal ultrasound was going to give the doctors the answer they needed? It was the third day of CM hospitalization now, and the renal ultrasound was completely unremarkable. Just one more thing to do now, a renal biopsy. A renal biopsy is a medical procedure in which a small piece of kidney is removed from the body for examination, usually under a microscope. It's a way to actually see what's going on in the kidneys. This time, what the doctors found out in CM kidneys was so remarkable. They actually wrote and published an article about this finding. Now, what are we looking at? Here you can see fibrosis in CM's nephrons. Fibrosis is a term that indicates that the tissue in the nephrons, the tiny filtering units in the kidneys, is being damaged. Fibrosis means thickening or scarring of the tissue, and here's the cause of the damage. These bright spots you see here are calcium oxalate crystals in CM's renal tubules. Now, calcium oxalate crystals are the most common cause of kidney stones. These are hard clumps of materials that are tearing through CM's nephrons and tubules, destroying his kidney function. Now, this brings us to an even bigger medical mystery. How is it possible that a man with no history of kidney stones, no risk factors, completely lost his kidney function at 61 years old? Due to oxalate crystals? There are various known mechanisms that can cause oxalate crystals to form, a surgery or a disease that cause increased absorption of oxalate, but CM didn't have any disease or surgery that would cause oxalate problems. A very high intake of vitamin C, like what happened in one of the case studies we have already seen up here, is also a cause, but CM wasn't supplementing any vitamin C. A dietary deficiency of calcium, magnesium, or water intake may also cause oxalate crystals. So now CM is being questioned about his diet. He said he was always drinking lots of water, but admitted to a diet that was consistently heavy in nuts and coffee and in many vegetables rich in oxalates such as rhubarb and beets and spinach and all that good stuff. But he also claimed to consume enough calcium by eating cheese and yogurt almost every day. So having oxalate crystals shouldn't have been possible for him. And yet, here we are. And you see, a case of kidney damage caused by oxalate crystals in absence of any of these risk factors is incredibly rare. It only happened around a dozen times in medical literature, and it's, well, worth publishing a paper about it. Almost time to see if CM was eventually able to make it home safe, or if he was going to have to do dialysis for the rest of his life. Before that, a very important question I'm sure many of you guys are thinking about now. Are oxalate-rich foods dangerous for those with chronic kidney disease? Foods known to be highest in oxalate include spinach, rhubarb, beets, legumes, nuts, chocolate, and coffee. And these are all very healthy for you, coffee and chocolate included. And while it's not recommended to consume coffee and peanut butter in the amounts CM was consuming, they could be part of a healthy diet. But CM's diet was what caused his kidney to fail in a very short amount of time. Can that happen to other people too? Well, that's unlikely for most people, kidney patients included. You see, bacteria in your gut will break down oxalates before they can cause you trouble. Dietary calcium is also going to prevent oxalate from crystallizing in the kidneys. And while many calcium-rich foods are to be avoided in a renal diet, taking Tums and antacids that are made of calcium carbonate is both a way to keep phosphorus levels down and to prevent any risk correlated to oxalate. Now, there are people that must pay attention to oxalate-rich foods, however, those prone to kidney stones. If you had kidney stones in the past, you are more likely to get them again. And if they are calcium oxalate stones, the most common type, limiting oxalate, will be a good strategy. People who have had gastric bypass surgery or surgeries that affect how the gut works may also have high oxalate levels in their urine. So if you have gut dysfunction or take antibiotics, you may want to eat a low oxalate diet. Now, also those that have to limit their water intake due to kidney disease may be recommended to follow a low oxalate diet. But for most people, the benefits of nutrient-dense, high oxalate foods far outweigh their risks. And well, CM didn't have any of these risk factors for kidney stones, as we have seen. So how is it possible that he had oxalate crystals in his kidneys? Researchers were only able to find one explanation for this incredibly rare phenomenon, a rare genetic mutation involving creatine protein, which could have caused inflammatory problems. I'm not getting too much in depth about this, but it was actually only observed in mice before CM's case. CM problem was also linked to gout, so this paper also tells us that there may be a link between gout and kidney damage caused by oxalate. Okay guys, do you want to see how it ends? Let's see if CM was eventually able to make it home safe. After his hospitalization, CM was started on dialysis. After 3 weeks on dialysis in the hospital, CM gained back a little bit of kidney function. Unfortunately, when he left the hospital, his kidney function was still too low for him to be dialysis free, but not all hope was lost. You see, CM never had chronic kidney disease, and by completely stopping what was causing damage to his kidneys, there is hope for him to get enough kidney function back. CM was also instructed about his rare condition and told to avoid oxalate-rich foods. Now guys, I'm glad I talked about oxalate and the risk connected to what some call an anti-nutrient, because as we have seen, some kidney patients should actually limit their intake of this substance. Let me know if you want to know more about how to avoid the risks connected to oxalate in a future video. And in case you wanted to see more real medical mysteries like this one, this video up here may be interesting. And this is all for today. Thank you for watching. God bless.